Well, it's been said that life should not be measured by the number of breaths we take, rather the moments that take our breath away. Living life to the fullest and making the most of every day is something many of us aspire to do, but it became a real point of focus for 46-year-old mother of two, Sunaina Mather, after she was diagnosed with breast cancer. Sunaina, along with Dr. Mark Citron, join us now. Thank you both for joining me this morning.
Good morning.
Now, Sunaina, I'd like to start with you. What was kind of your inspiration behind the outlook that you kept after you were diagnosed with breast cancer?
When I was diagnosed 10 years ago, I, just like everyone else, very shocked. And when the shock wears off and you're left with the disease that you're diagnosed with, I thought of something that my mom always used to say to me about positive thinking. It just took on a new meaning for me at that point, and I really embraced it and started living life and just making sure. I kept saying to myself, just you'll be fine, and that's what has really kept me going for the last 11 to 12 years. And it's just, there are days where it's very hard to kind of pick yourself up, but you say to yourself, it'll be fine. Everything will be fine. And that's what I try to say to my family also, Mom's gonna be fine. I'm gonna be okay. And that's the best thing that I can share with anyone going, that's in my shoes, that if you stay positive, that's half the battle. And it really can help you get over everything.
That's amazing and very motivational to people who might be going through the same thing. So, Sunaina, what would you say to women who maybe were recently diagnosed with breast cancer? Any insights for them?
I think it's most importantly, you have to stay informed, and you have to, be in constant communication with your medical team as well. And the doctors can only do so much, but it has to be a marriage between, having your family, your medical team, and yourself. Everyone has to kind of work in collaboration. So, stay informed. There's so much out there. Stay informed of all, that's available to you. Speak with your doctor, and positive thinking. It really will help, and it'll go a long way.
And you mentioned collaboration. Dr. Mark, it's so important that one of those collaborations is with your health team. Maybe talk a little bit about why that is so important and some of the things that you kind of assess with your patients.
Well, it's very important to have a close relationship with the healthcare team, especially the oncologist. Communication should be open and clear so that the objectives of treatment, the side effects of treatment are well described, explained honestly for the patient so she can make the best decisions for her life.
Absolutely, and we're talking about more than cancer care and more than even medications. We're talking about emotional support, and how does the healthcare team kind of involve themselves in that way?
Well, I think it's critical to discuss psychosocial support for patients and to explain what resources are available. Even in a patient like Sunaina, when they have such a wonderful family and friend support, it always can help to speak to a professional, especially for young women who are facing all the distressing complications of breast cancer.
Absolutely, and I think one of the most important things too is to realize we're not alone. We have our family, we have our healthcare team. So before I let you both go, what would you advise women going through this? Where can they go for more information? What should be their first step?
Well, certainly they should speak to their physicians. I think a good website for breast cancer is breastcancer.org.
Absolutely. Sunaina, I want to thank you so much for sharing your personal story with us this morning and inspiring women all over the country. And Doctor, thank you too for joining us this morning.
Thank you so much.
Thank you.
Now stay with us. The Morning Blend will be back after a short break.